but we get referrals all day, every day from holistic integrated pediatricians, nurse practitioners, even neurologists and epileptologists, OBGYNs and midwives. We get them from PTs and OTs and speech therapists and counselors because we're not trying to do their job. We're trying to help them do their job better because we're going to send them kids who are well adjusted so they can get 10 times to 100 times more out of the care they do when the kid is not subluxated, but better connected and regulated and functioning. And then they know, because they're educated through this thing that we're teaching to you, the kid comes into their clinic, they need to get them adjusted because they're going to get a lot better speech therapy results or physical therapy results or detoxification and functional medicine results if that kid's nervous system is no longer dysregulated. All right, chiropractors and chiropractic students, welcome to the Family Practice Podcast. You know, the one you've been waiting way too long for, because this podcast will actually stay focused on chiropractic. Not only what it takes to get world-class clinical results for kids and families in your community, but also what it takes to build a legendary, incredible family practice that takes care of your family way beyond your dreams. I'm Dr. Tony Ebel, and I'll be joined by Dr. Matt Hill, Dr. Ellie Wright, Jackie Jacobowitz, and incredible guests, chiros, associates, CAs, all these folks making massive impact around the world. We're going to cover everything: pediatric, perinatal, family practice. This is the podcast you've been waiting for, because moms and dads and families have always needed us. Now they're finally ready for us. I hope you're ready for the Family Practice Podcast. Let's go. So with this one, because I really just want to be matter of fact, I just want to be direct and to the point. I know that sometimes this stuff, when we talk about like clinical protocols, people can, in chiropractic, awesomely, we have multiple different techniques. In fact, you're going to see that's one of my things on the list of the gold standard. These are the 5 to 6 things you must master, must do to get world-class clinical results with perfect storm subluxated, dysregulated kids today. They're so trapped into dysautonomia and subluxation, you cannot use the clinical protocols from even a generation or two of pediatric chiropractic and expect to get results today. I wish it were different. I wish kids were way less sick, which is synonymous to way less subluxated, but it's easier than ever to get our message out. We have the best time ever growing our practice. The world is literally sprinting towards us. They're hauling ASS. I own donkeys. I live on a farm. That's literally where my studio is right now. And I do own many donkeys. So I feel like I could have said that one out, but I'm a pediatric chiropractor, so I spell out all my swear words, and I'm a dad of 4 kids too. So you cannot do this as people just haul ASS, almost said it again, away from medicine towards anything, not that. That's kind of where they're going. They're like, let me get on Amazon, let me get on Instagram, let me get on Google to follow every natural health influencer. They'll buy a sauna, they'll cold plunge, they'll get patchouli, they'll do whatever. But they need to get into chiropractic. They need to get into our offices. They need to get freaking on our tables and get adjusted. And so when they do, they're so stressed, they're so subluxated, they need a higher level of clinical care. So I'm going to turn the slides on here in a second, and I don't want you to overthink any of these. This training, this slide deck, the gold standard, these are the 5, 6 things you must do clinically to get world-class clinical results. You guys, I hate talking about myself more than anything else. Our practice serves between 4 to 8 patients per month. We serve thousands every single week, or not thousands, sorry, not want to chiro math that. We're about 1,200 a week. And we serve patients, about 4 to 6 to 8 of them, from out of country every single month, okay? Now, I bring that up to let you know, they're not coming for a special technique. They're not coming because we do the same thing everybody else does. Nobody's going to put their kid on an airplane and live in Crystal Lake, Illinois for 2 weeks, 4 weeks, 6 weeks, depending on the level of the intensive they're doing, when they could get this kind of chiropractic next door or anywhere else. So I'm not going to teach you like, hey, here's how you get good at pediatric chiropractic. I'm going to teach you the most advanced clinical components you must have. There's a lot within each of these, obviously. That's why we have an entire, certification program with Life University and do the work that we do there. But you need to know this stuff. You need to move towards this stuff because it's not about us. These are not important for us. They are. Your practice growth is dependent upon your practice size, your impact. I can't say income without impact. I go from an ROII, return on impact, creates income component, live my whole life that way, never won't. But you can't grow your practice. You can't meet any of your goals if you don't first master clinical results. Nobody's going to bring their kids to a chiropractor who's vanilla, who's bland, who's like everybody else, okay? parents decide differently with their kids' health than they do their lumbalgia. All right. So you got to be at this level to serve kids and families. That's enough introducing it. Let's hit it. All right. This is the gold standard. And I know it because I've been through the licks myself. Number one, deep dive neuroscience investigation. You got to not only have certainty, you got to have courage, you got to have clarity, you got to have conviction, you got to have confidence coming out of your eyeballs. You got to know the 10D model, perfect storm, neuroscience, dysautonomia, developmental dyskinesis. You got to know about fertility, prenatal stress, birth trauma, toxic load theory. You got to know how to care plan. The miracles do not come from how great of an adjuster you are. You cannot have that. I'll get to that. They come from care plans. You have to be able to assess not just their symptoms, not just their spinal, postural, palpatory, leg length, pelvic dysfunctions. You have to be able to actually, if you're going to be a nervous system focused chiropractor, when someone says they're subluxation based, but then doesn't do neurological testing, and I'm not talking about primitive reflexes and vestibular function. That's more OTPT. That's more secondary, tertiary components of subluxation. You can kind of church it up a little bit and call those neurological exams, but they're more medical than they are chiropractic. We now have, thanks to the wizard of wizards in neuro subluxation-based principle chiropractic, started with Dr. Gentempo and Dr. Kent, and now Dr. Fletcher has taken over for CLA and the inside scans. I probably actually do a pretty poor job of teaching the value of these because I've never even considered for a moment practicing chiropractic without it. Quick backstory. I actually started as a CA in undergrad. I knew I was going to chiropractic school, knew I didn't know anything about it. And I went to work with another mentor that I didn't mention on the other one. And I'm so glad I'm bringing him up here because as a chiropractor who the chiropractors before us literally paved this path that taught me everything. And then these mentors, and a small town farmer dude, my mentors and people that brought me up are everything. I'll never not speak to them by name with reverence and respect and gratitude. But Dr. Rick Albert was an incredible Gonstead, take x-rays. My job was to literally take the x-rays, put the BB on where the break is. He was a literal x-ray, Gonstead, full system analysis, is master. And he was one of the first Insight scan users. So I have a blessing of my upbringing in chiropractic only exist truly principled, truly subluxation based, and truly neurologically focused because we ran thermal and Insight scans, and now the Insight scans have the HRV. But if you're talking about the nervous system and not measuring it, there's a huge gap of incongruence there, okay? And maybe even more important than incongruence is confusion. Because people are visual learners. I think I struggle sometimes to talk about the insane value of this because like a lot of things in chiropractic, we've complicated the Insight scans and technology, not anybody else, okay? Parents love this. Parents demand this. Actually, it's the number, I think, 3 clicked page on our website. It's what parents reference all the time in their reports and their testimonials. Once they saw the scans, everything made sense. It's what they've been looking for the whole time. It's unbelievable how much I could talk about this for an hour and still not do the job of giving you all the value points to this. But I'm an Iowa farmer and a practicing family chiropractor who can't imagine life without the Insight scans. So let me simplify it. If you're going to talk about the nervous system, you need to measure it. You need to measure with the Insight scans because to get world-class clinical results, you need to know these 3 things. And this is simplifying it. There's a lot more, but this is start here. Number 1, is the kid subluxated neurologically? Are they literally subluxated? Number 2, if yes, to what degree, to what severity, to what significance? The most beautiful thing about the Insight scans now is Dr. Fletcher has brought in the core score and what we call the neurometrics. That's a branded, copyright protected term from PX and how we work. It's a brilliant AI invested dad used that term back to me. And I'm like, I'm running with that, buddy, man. And so the truth is this conversation here, you can measure the severity, the depth, and then you can help figure out number 3, subluxation patterns. That's just the first 3 things we use the Insight scans for clinically. Now, if you've thought, oh, the scans are for communication, they're for screening. No, okay? That is just another thing they help grow your practice with. They are literally clinically gold. And so they measure deeper, they measure more accurately, they measure more in a clinical utility because we teach in PX, scans dictate plans. The reason that I think so many pediatric and family chiropractors are wussing out on care plans is because they're not measuring actual nervous system dysfunction. So if you're only measuring symptoms, that's not chiropractic. And if you're basing your care plans based on symptoms, that's not chiropractic. That's medicine. And if you're measuring them only based upon palpation and posture and primitive reflexes, you're getting there, but you're not all the way there, okay? So number 2 is that. Number 3 is what I've already mentioned 2 times before we even got to number 3. You got to get after it with care plans. That's why we needed the presentation from before first. Kids are more subluxated, more dysregulated, and I hate this. I despise this. More severely, more nastily, making words up than ever before. So when I hear of chiropractors giving kids, 2 times a week for 6 weeks and we'll see how it goes, I was there for a very short bit, thankfully, for having such incredible mentors. That's not I'm so wonderful. That's I've been so blessed to have such mentors. And no, I took two different pediatric chiropractic-ish. I have to say ish now because they told me it was all about chiropractic and only about half of it was. 2 different certifications about pediatric chiropractic, and I was never taught care planning once. So what did I default to? Symptoms? That sucked. I knew right away as a philosophically sound chiropractor, I didn't want to do that. So what did I default to after that? Same thing everybody else did. 3 times a week for 4 weeks, 2 times a week for 6 weeks, 1 time a week for severe cases, 2 times a week for 6 weeks for moderate cases, right to wellness for babies and simpler cases. And then the dreaded, don't ever say it after this training again. Let's see how it goes. Do you think a parent wants their doctor, who's supposed to be the trusted authority of their kid's nervous system, which governs their entire health, is supposed to say, let's see. Let's throw some darts here and see what happens. Yeah. Right now you're like laughing / uncomfortably laughing / how come nobody taught me this before? Guys, when I get a blessing to teach other chiropractors, I feel like I put us right in the same kind of seat and mindset and framework that we awesomely get to put parents when they're coming in and patients when they come in, and we teach them about subluxation and the nervous system and our philosophy, and they go, dang, how can nobody taught me this before? I'm so excited / so upset that I didn't have this data and this information before. Same with care plans. And it all starts with the certainty. You have to understand the depth of subluxation. So if you've spent most of your, like a lot of chiropractic, pediatric, chiropractic-ish certifications, if all they're talking about are primitive reflexes and nutrition and all these other bells and whistles, they're not diving deep into the neuroscience of subluxation. They're not going to give a deep, updated, gold standard care plan. Now, number 4 is a fun one, I think. Number 4 is sometimes, because every time I teach pediatric chiropractic at like a standard CE thing, state convention or seminar, every time people come up to me, there's awesomely, people are so fired up to serve kids. It's in all of our hearts. And they come up and they always will say, hey, I got 2 questions. These are the top 2 questions. We're playing Family Feud edition. After Tony Ebel talks at a chiropractic seminar, what are the top 2 questions that people ask? Number 1, what do you say to parents to get them to bring their kids in? Why do we think that scripts are the path to success instead of just being authentic, convicted, certain, and clear, and empathetic, compassionate, relatable, and simple with our communication? Communication is hard until you figure out how to make it simple. And scripts will not build your pediatric practice. Moms and dads can smell a script from a mile away. Second question has to do with this slide. The second question, because it's a chiropractic seminar, we're playing this scenario out in. The second question is, what technique do you use? Are you Gonstead? Are you Diversified? Are you Thompson? Are you SOT? Are you Logan? Are you Toggle? Are you MC2? Are you TRT? Are you Tulski? Are you... I don't know. I ran out of them, okay? And the answer is yes, and yes, and yes, and yes, and yes. And you're like, man, right now Tony's being annoying and redundant. Purposefully, because I love you so much, and I want you to know that what practice taught me is that when you choose the technique that is not best for you, because your mentor did it, you were the club president of it, and you've been to that same seminar 17 times, when you choose the technique that is not just best for high volume, or best for your shoulders, or best for whatever, I could give you a bunch of reasons, and I understand and empathize with them all. But when you choose the best adjusting approach, aka technique, for that child's very specific nervous system subluxation dysfunction, subluxation pattern. See, what's different is we use all the techniques. We are a multifaceted technique mixer. And it's funny to say that because we're so principled and obsessed with chiropractic philosophy and subluxation and staying in our lane. But what I learned is I started flat out Gonstead. I can set your grandmother's T2 in the chair just with ease, okay? Seated. None of this, just laying down, making it easy stuff. And I can also toggle like a boss. Shout out Dr. Straz and Dr. Bogo, my Palmer teachers. I am not breaking that egg. And I also have an integrator on me at all times. And I can go tonal. I can go sustained contact. I can go Logan. I can go SOT. I can go cranial. I can go neuromyofascial release. Why have I mastered all of these techniques? Because it's not about me. I just get to be here as a chiropractor, so I'm kind of telling my story to give you some relatability, but we don't work for chiropractors. We work for them. We serve them. And what I can tell you is raging bull, wound up, stuck in the storm, sympathetic dominant, acutely more recently kind of still stuck in that first phase of subluxation. I should have mentioned that because that's more advanced stuff we teach. But when they're in that stage, you got to go light. When they're wound up, you got to go light. But in today's world, you're going to run into more. Write this down. I'm going to pretend I'm Dr. Chestnut, one of my main mentors. He would always be like, write this down. And I'll be like, I'm writing everything down you say, man. You're a master. So you don't even need to say, write this down. This one, though, write this down. You are now in an entire family practice model, not only adults, but kids as well. You are serving the most dysregulated, neurologically exhausted. The clinical word there you need to know is exhausted population ever. Dysregulated, what we call drunken bull, neurologically exhausted. We call that stage 3 of subluxation progression. It's this whole thing we teach because they run out of sympathetics, they run out of gas, and they're in that exhausted state. You have to adjust those kids and those patients differently. They need to be activated and stimulated. And so while we mix techniques, we do not mix in anything else. I don't want this to be controversial. I don't want this to be like, oh, that program versus this program. No. Again, write down, blinders on, what's best for these kids. And more importantly, what does the neuroscience teach us? What is our clinical experience? Evidence-informed care has to do with the deepest, bestest, most updated understanding of neuroscience and clinical research. What's actually going on here? Number 2, practitioner experience. What have you observed? What patterns? What's working? What isn't? Number 3, parent preference. I'm mixing all of those together, using the word mixing, to tell you I've been in practice for 18 years. So I've never been a controversial political person in my life. I've just been what gets results for my patients. That's what God put me here to do. I'm going to do that, do more of that, and get better at that every single day. And now God has called me to teach these things to other chiropractors every single day. Okay, I'm half and half in practice, half teaching. And so, because I'll never leave practice, because otherwise I'll be a craptastic teacher, wouldn't I? If I'm like, back in 1988, what I used to do, I'm in practice today, which makes me an effective clinically application. This is how we get results teacher on formats like this, because I'm not talking about what I think works or what used to work. I'm talking about what does work and what we've learned. And the truth is this, and it's on the slide. You will serve the most subluxated, dysregulated, neurologically exhausted, overwhelmed, dysfunctional, neurologically confused kids and families ever. Their nervous systems are so subluxated, dysregulated, incoordinated, they can't even do good things well. So when you add in too much good, you ever heard that phrase, too much of a good thing? Yeah, apply that to your clinical work more than you ever have. You have to be patient. You have to take care of the foundation, their central and autonomic nervous system, their subluxation first, before you layer on other therapies and services, which you can either, if you're in what we would call kind of a therapy or a services desert, where you don't have high-level PTs, OTs, speech therapists, everything else, PT, functional med. I practice in a very advanced kind of area. So the last thing I want to do as a business owner is deal with other services. And I did all that, remember, not only did I learn the clinical lessons, but I learned the business lessons. Refer out, okay? Collaborate with other pediatric providers if you feel like your kids need PT, OT, speech. They will. If they need nutritional intervention, they will. If they need lifestyle coaching, they will. Who told chiropractors that we need to do everything and be everything for everybody? I bought that line, hook, line, and sinker. Remember the name of the practice, Premier Wellness Chiropractic. Not anymore. We've got one job and one job only. We provide chiropractic, the most advanced, gold standard, neurologically focused, principled, subluxation-based chiropractic to our kids, families, and patients than ever before. And we darn well know once we get their nervous system to a more stable, connected, functional place, they might need other interventions to catch up developmentally, to continue to heal, to get rid of toxins. And we refer out. I built an entire network of incredible providers. I've done the Perfect Storm workshop almost as many times for other providers in my community so they know how bad their kids need to get adjusted so they get better results. Are you seeing the big picture here? These things will come into play later, downstream. The way you get a kid better is there's a sequential path to the perfect storm. So you understand that first. They started out subluxated. It starts with the nervous system. God's designed for health, development, healing. All of it starts with the nervous system. You've got to start there and stay there solely, only for a long enough adjustments, enough frequency, enough excellence to get slide before, the right techniques, again, techniques usually plural, for long enough to get the foundation. You use the insight scans. So there's 7 metrics on the insight scan. So we can actually measure when a child's nervous system function has been restored enough to be better connected, better coordinated, and what we call neurologically stable in the ready state. And then we send them to PT, OT, speech, functional med for continued layered healing. It's the most advanced clinical protocol, collaborative. And by the way, side effect, number one way to grow your practice, because now you're not only going out and getting new patients and telling the world about subluxation, but we get referrals all day, every day from holistic integrative pediatricians, nurse practitioners, even neurologists and epileptologists, OBGYNs and midwives. We get them from PTs and OTs and speech therapists and counselors because we're not trying to do their job. We're trying to help them do their job better because we're going to send them kids who are well adjusted so they can get 10 times to 100 times more out of the care they do when the kid is not subluxated, but better connected and regulated and functioning. And then they know, because they're educated through this thing that we're teaching to you, they know when a kid comes into their clinic, they need to get them adjusted because they're going to get a lot better speech therapy results or physical therapy results or detoxification and functional medicine results if that kid's nervous system is no longer dysregulated. So we get copious amounts of referrals from other community connections and professionals every single year because we don't try and do their job and be everything to everyone. We are a master of one, not a jack of all trades. And we make referrals to them because for our kids to get all the way better, we might need them to do things for them that we're not going to do because we're chiropractors, not PTs, not OTs, and not nutritionists, okay? So, number 6 is intentionally redundant. There's really 5 things. And then number 6 is just saying with love, with empathy, one more time, nervous system first, nervous system foremost, stick with it, stay in it. And if you just 10x, 100x, your certainty, your clarity, your conviction, dive deep into the neuroscience. The deeper you go into the neuroscience, the more confidence I know for sure, just like my path as a chiropractor, the more you will know I'm going to get in my lane. I'm going to stay in my lane. I'm going to become more certain, more convicted. I'm going to measure the function of the nervous system. I'm going to track the changes, not just the symptoms, not just the spinal stuff, not just the leg length stuff, not just the postural stuff, not just the primitive reflex stuff, but the actual root cause stuff. I'm not going to wuss out on care plans. I'm going to tell parents the truth. I'm not just going to stick to one technique and hope that everybody has the pattern of subluxation that matches that technique. I'm going to literally expand my tool set and my arsenal of impact making and get more techniques. I'm going to be patient if I've been trying to rope in all these different things all at once and tell people, oh, you got to do this, you got to do this, you got to do this, you got to do this. You're already overwhelming and already you're increasing the overwhelm of an already overwhelmed nervous system and family and parent and kid. So focus foundationally, first and foremost on chiropractic. Stick with it. Never waver. Do it with excellence. Become the gold standard and report back to me in a few months what your clinical results are like, what your practice results are like, and how much fun, conviction, confidence, impact you're having. If you love this stuff, the way we teach, I know I'm a wee bit punchy. I am short, stocky, and bald, and I'm 43, and I've been in practice for 18 years, and I've been around the block. So I kind of come out, and I got 4 kids, 3 of them girls, so I just don't have any more time for, let's dance around this. God called me to this. He will give me however long he gives me here to get this work to the world. We are taking it through directly to parents through another podcast I have called the Experience Miracles podcast. But this podcast is for us. This is for moving chiropractic forward. So if you need anything from me and you love this stuff, you love diving into the neuroscience, you love talking about building a family practice, you love chiropractic philosophy, talking about subluxation, talking about communication, talking about chiropractic, growth and success strategies, and maybe you love sarcasm, satire, and some fast talking, raging bull punchiness that I bring to the table. I just want you to know that I freaking love you. I respect you, and I'm so grateful for you. Chiropractors, we're cut from a different cloth in the best of ways. A lot of our limitations of our own doing Most of our subluxations are, self-induced. And here's what's awesome about them being subluxations. They're very adjustable. They're very figure-outable. And the world is just literally begging for us to figure it out. These moms, when our platforms blow up? About 11 o'clock at night to 2 a.m., okay? We get more directory hits. Instagram Reels will go off late at night because their kids aren't sleeping, they're not sleeping, and they're not getting the answers from traditional medicine, and they're not even getting it from functional medicine. Because medicine is medicine. And while they maybe are, treating systems with supplements and detox kits versus medications and pharmaceutical interventions, that's still not chiropractic. That's still not getting to the root foundational nervous system subluxation and dysfunction. Only you know that science. Only you can share that truth. And then not only can only you communicate and get that truth out to the world, when they hear about it, only you could do something about it. Nobody else is trained to adjust. Y'all went to school for that long, that deep, that much, 4 parts of boards, and all that, investment. You put all that investment in, and here you are, ready to serve. There's a higher level. And I hope that through this summit, if it's one of you that is now called to serve kids and serve families at a higher level with more conviction, more clarity, more neuroscience, and more advanced clinical application and gold standard, y'all, reach out, hit up the podcast. I'm not hard to find. Everybody on this crew knows that I'm all in for their mission and the strategic action plan to push chiropractic forward. I will take up the pediatric and the perinatal and the family torch, and I will haul forward loud, strong, convicted, because this is the path God called us to. We know the neuroscience. We know the miracles happen in our practice, and it's our responsibility to step up, never shut up about it, and then 100% clinically be about it and back it up with world-class clinical results through these 5 to 6 steps. Every patient, every time, every kid counts. Hey, Dr. Tony here, and I wanted to say thank you for listening to the Family Practice Podcast. If you enjoyed this episode, like and subscribe to the show so you don't miss a thing. Also, if you're looking for more content from us, you can absolutely subscribe to our newsletter, watch exclusive episodes on YouTube, and dive deep into the articles and blogs on our website. All of this is linked in today's show notes. Thanks again, and we'll see you on the next episode.